My name is Amanda Boyson. I am the clinical coordinator at our respiratory therapy program here at the Mayo Clinic School of Health Sciences. I actually am an alumni myself of this program and graduated back in 2016 and became faculty within the last couple of years. I'm originally from the Twin Cities in Woodbury and came down here to Rochester for school in the program myself. So respiratory therapy was something that I knew pretty quickly in high school that I wanted to do. I was a child who grew up with asthma, so I was in and out of the hospital quite a bit. I want to be able to give back to my patients and be able to relate on that level of I know exactly what you're feeling like when you can't breathe. And that's been like one of the most rewarding things for sure about this career for me. One piece of advice I'll give in the sense of if you've never heard of respiratory care in general or just starting to, definitely do your research about the profession. Naive me thought coming into the program, I know everything of what a respiratory therapist does, but I didn't realize how big of a scope of practice that respiratory therapists have within the hospital setting or outpatient setting. Additionally, with that, I highly encourage you to be able to job shadow. Job shadowing is a really great opportunity for any healthcare profession altogether to just get a better idea of being in that person's shoes. Say yes to all of your experiences, but especially in the clinical setting, because for us, one nebulizer may not be the same as another nebulizer treatment. So maybe a patient may have an adverse reaction, maybe something might not go as planned. Then you're going to be seeing that experience, having a little bit more of kind of a scope of knowledge based on that, like, okay, I've seen that before, that this can happen. Now I kind of know what to anticipate. I thought mentors were supposed to be kind of formal. You kind of sign up on a list, something like that. That was just my kind of overall assumption. But actually, I found out that mentors can be like everywhere and anywhere. Really talking to just any of your colleagues around you. That's kind of the first place that I started, and I let them know what my interest was. So once I started to develop an interest in education, I let my supervisor know, some of my colleagues, and then additionally, those colleagues were able to introduce me to other opportunities to seek out from there. They introduced me to different providers that I could work with on their education side of things when they're working with their residents. So then I can educate those residents on mechanical ventilation, on breathing tubes, kind of those specific things within respiratory therapy realm. But definitely, if you are interested in something, just start talking to people. All the avenues will start to kind of fill in themselves, because you don't know who knows who necessarily here, which is really cool about all of us being at Mayo to be able to create those connections.